Lung cancer is one of the most common cancers that we see in the United States. And our goal is to get all patients with a potential for having lung cancer and a finding on their scan to be seen in a very rapid period of time where diagnosis can be reached, and if unfortunately they do end up having cancer, that they can be treated effectively, quickly, and within the walls of our institutions. All cancers, but in particular lung cancer, when identified at an early stage, makes it that much easier for us to treat. And the treatments for lung cancer have really been revolutionized over the past few years.
Patients who have a history of smoking, who currently still smoke, and who are considered high risk, we highly recommend that they get that lung cancer screening test. It is painless and it really is beneficial to improve survivability of that patient.
People with early stage of lung cancer, they may have absolutely no symptoms. They are walking and talking just like us. So because of that reason, we really stress on low-dose CT scan to screen for lung cancer. People who are current smoker, or if they have quit, they should have quit within the last 15 years. And they have smoked at least 20 packets smoking. If their age is between 50 to 80 years of age, these are the people who meet criteria to screen for lung cancer. And we screen them one CT scan every year.
Oftentimes, lung cancer is picked up by other means. Somebody comes to the emergency room because they have a kidney stone or some other problem, and a CAT scan is done, and lo and behold, on that CAT scan, they see a nodule. And so we in Riverside have decided that it's critically important that these patients who might potentially have lung cancer be treated quickly and effectively through a lung nodule clinic.
When we get a scan of anybody's neck, chest, or abdomen looking for possibly other disease processes, there's always a bit of lung that's included in that. Say you had a car accident and we did a CT scan of your chest in the emergency department. We're always going to look through the entire lung. And if we identify a lung nodule on a scan where we are looking for trauma, that would be considered an incidental lung nodule. By and large, most nodules we see, which are small densities within the lung, are usually associated with infection. There's other benign causes also. So it's rare that a small pulmonary nodule will become a cancer, but when we do see one, we certainly want to keep an eye on it, watch it when it's over a certain size, and make sure it doesn't progress. Because if it's growing, then we are concerned it's a cancer, and then we want to catch that and treat it as soon as we can, because that greatly improves your odds of disease-free survival and a longer life.
When we detect lung nodules that can come from low-dose CT chest or from incidental finding, radiologists make a note in their result to send the referral to Lung Nodule Clinic. And primary care doctor or any ordering physician can put a referral to Lung Nodule Clinic, and that referral is always marked as urgent. And physician will see those patients within 7 days. That has extremely reduced the timeline from getting CT scan up to the first pulmonary physician contact. So this streamlines the process and this expedites the process a lot.
When I got the CT scan that showed the nodules, they came up with the plan. Here's what we're going to do. First, let's get him in for a PET, and then we'll do the biopsy, and then we'll come up with a treatment plan. And that sounds like something that would take a month to figure out. They did it in a week. I got a bad CT on a Thursday. The following Thursday, I was getting my biopsy. The following Monday, I was in the chair getting my first infusion. So from getting the really bad news to what's going to happen next, that's the question. We found out because all the answers were coming from the team, and they are amazing.
Whenever we get a lung nodule, we bring them here promptly, evaluate them, assess them, and give the right recommendation for the patient and their families. That relieves their fear, anxiety, and this is a teamwork, and we have the right team here. Riverside cares about patient and their community, and we like to do the right thing. Whenever there is a lung nodule, we want to find out early if that's a cancerous, and if it is, we like to treat them early on. Because of that reason, we started this Lung Nodule Clinic.